Dr. Antonucci, tell me, there is people, patients out there like me and other people, we every so often, we have a missing tooth, maybe 2 or 3 or 4 missing teeth, and then usually they are missing in the back for a while already. Because if they're missing in the front, we run rather fast to a dentist because it looks awful ugly. But in the back, and it appears, Dr. Antonucci, it appears that nothing really bad is happening, and yet every dentist like you keeps telling us you've got to replace those teeth. Can you shed some light on it of what is going on? Why don't we see a major bad impact, and yet it seems to be such a big deal?
The bottom line, when patients come into a dentist office and they're not feeling pain, they're not. They've gone on a regular basis. In their mind, they've had an exam a year ago. They're not feeling pain. They're eating fine. They don't see a problem. In their minds, they don't have a problem. And it's very difficult for patients to accept that something may be wrong, that when they don't know or they don't realize that it's wrong. I often say to my patient, if you looked in the mirror and you saw on the tip of your nose a bleeding sore, you would right away run to the doctor to get something done for it because it's evident and obvious to you. If you looked in the mirror and you saw a black tooth in the front of your mouth, you would right away know that there's a problem. You don't see what's in the back. You don't have the ability to look and to understand and to see the things that we can see when we're examining you. And sometimes it's difficult to understand why something can be so problematic if it's not hurting or if it doesn't feel like it's broken. And that is an issue that we deal with all the time. We often use in our practice several diagnostic technologies that help me to educate patients on in terms of what exists in their mouth. We use intraoral cameras regularly. What a camera does is it shows full size the problems that exist in a patient's mouth, and in order to help them understand what they own, what is moving around with them every day. We use diagnostic technologies such as luminofluorescence, which use laser energy or light energy to look through a tooth and to detect decay. And often problems they're not at the point where they're creating pain for a nerve, but they're at a point where they are problematic. And
okay. Dr. Antonucci, let me interrupt you for a second here. Let's just specifically talk for a moment about the missing teeth. A guy has missing teeth. Doctor says you got to replace those missing teeth.
Okay.
Shed some light very directly on that, please.
Missing teeth are a problem because for many reasons. Teeth are there for us to be able to chew properly. They're there for us to be able to be comfortable when we're eating. They're there for support. When a tooth is lost, your chewing capacity is diminished. You can't eat as well as you were able to. You can't grind the food up into smaller pieces, so your digestion is affected. That has a whole number of ramifications on your overall health. When teeth are missing, the support of the tooth behind it is lacking something, and that tooth will drift because it was designed to have something buttressing it or helping it to stand tall where it is. When a tooth is missing, the tooth behind and the tooth in front will tend to drift and shift. That causes problems, and also the tooth on top doesn't have support, and that will drift and shift. That causes a number of problems. Causes problems with the way the teeth come together. That has effect on your jaw joint. That has an effect on the musculature. It has an effect. It can cause headaches. It can cause noises in your joint. The term TMJ, many patients are familiar with. What it refers to is a whole complex of problems that go on with our bite. And that's related to many times missing teeth. When teeth are missing and we are unable to properly clean around them because they're shifted, they're tilted, they're crooked, they're not straight, periodontal disease becomes much more easily something that happens much more quickly. It's something that is harder to avoid because it's harder for any patient to cleanse properly. Spaces start to develop that wouldn't have developed otherwise.
I see. So basically what you're saying is the teeth are holding each other in place. So if one or two is missing, it's kind of like with a fence. They kind of start falling apart and start going all over the place and shifting each other. And also it's difficult to clean. And one thing you said, this is very important. So what you're saying is, it kind of like from a mechanical viewpoint, let's say you have a cogwheel, several of them, and if there one or two is missing or otherwise broken or crooked, then the whole machine starts, rattling. So if that happens to the joints, you're using them uneven, you said you can even get headaches and muscle pains, maybe neck pains and shoulder pains. Is that what you're saying?
Yes, there's a number of problems that occur with the missing tooth, and they're not problems that occur overnight. They're problems that take a long time. But the fence post analogy is a good analogy. You have struts holding up a fence every so many feet, every 10 feet or so. If you have a fence that's running 100 feet and you remove 2 struts in between, that length of fence is now not supported, and that length of fence is weak. It was designed with a certain engineering in mind to have so much support. Our mouths have evolved or have been designed, have evolved, however you want to look at it, to have the type of support that was intended. When that support changes, a whole number of things happen, and those things don't happen overnight. They happen slowly, but by the time that we realize there's a change, the changes are sort of drastic, and the changes come in the form of pain. They come in the form of decay, they come in the form of periodontal disease, and they're all preventable if they're treated early.
Well, who wants to have headache? I mean, so are you telling me that, let's just say a patient who had some headaches for a while and maybe some other muscle pains around the neck, shoulders, and he might have missing teeth, he might not have missing teeth, because I'm sure that mouths can get out of alignment even if you don't have missing teeth or are out of alignment from forever. Do you think would you say that it is maybe wise or prudent for a guy to visit a dentist like you and look whether the mouth is out of alignment, and that maybe that may solve the headache, or at least eliminate that, no, it's not the mouth, must be something else? Would that be a good move for patients out there?
Well, it's a good move for anyone to visit their dentist at least twice a year.
Sure.
Because
I'm talking specifically now about somebody who has headaches and neck pains. He doesn't seem to be get reading off. On top of it, he knows he has a few missing teeth, but they don't bother him. Literally like, hey, check it out. I'm not saying it has to be that's why headaches come, but the chances are starting to get high, and it could well be. You might as well check it and or eliminate it and or fix it.
Well, as you just said, there are many causes of headaches, but one cause that can't be ruled out is occlusion, or your bite, or the way your teeth are coming together. The whole complex of it's a beautiful system. It's a very complicated system. And when a little piece is missing, it can cause a big problem. So you take one tooth out of the mix and some teeth shift around, the muscles become, they have to work differently, and they're working not in sync. And when that happens, headache pain can be caused by tooth problems. They can be caused by a number of reasons. And so, as well as going to your general physician, and as well as going to an ENT doctor or a neurologist or a sinus specialist, a dentist is a good idea also, because it is one of the many reasons that chronic headaches occur.
Wonderful. Very interesting information. It's quite something. Headaches from dentistry, or dentists can fix headaches. Quite something. Dr. Antonucci, thanks a lot.
You're welcome.